afternoon. My name is Ada Amaya. I'm a graduate student at Lamar University, and thank you for the opportunity of letting me present during your meeting. The presentation is about pneumonia and pulmonary embolism, which hopefully it'll help you prepare for your SSRX coming up in November. Okay. The objectives, as nurses, you are to recognize the signs and symptoms of pneumonia and pulmonary embolism, and you are to analyze nursing interventions for clients with pneumonia and pulmonary embolism. So theory drives our nursing practice. The theory I chose was humanistic nursing theory, created by Dr. Josephine Patterson and Dr. Loretta Zitterdad. I don't know if I'm saying that right. Patterson was a public health major with a doctorate in nursing science. Zitterdad was a psychiatric nursing major with a doctorate in philosophy. So they both met in the 1950s and at Catholic University for a graduate program. And so they created a task force to create a new program that would combine psychiatric and community health elements. So the program eventually evolved, and the humanistic nursing theory was created. So many nurses confirm that nursing is person-focused, and that shared experiences during nurse-patient interactions through the between accomplish a caring relationship. So the nurse understands that everyone is a unique person. Even yourself as a nurse, you are your own person. And in nursing situation, you as a nurse, you hear your patient call you, and you respond to that call. So when that occurs, you enter the between. As new nurses, I challenge you from now on to reflect on your own experiences that you're building up on, and put them into context for whatever current client situation you face. Synthesize your knowledge and become a source of continuous evolving information. Apply your knowledge in your practical clinical setting. Had y'all heard about the humanistic nursing theory before? No? There's a few theories that fall under it, like the Watson's caring theory. It's my favorite. I always use it. Okay, so brief overview about pneumonia. Infection in the lungs. Okay, different types of pneumonia. Can y'all list a few? Aspiration, I heard that. Hospital acquired, good, very good. Another one?
Pneumocystic pneumonia.
Community acquired is what I was looking for,
Oh,
right?
okay.
Because that's your bacteria, right, when they diagnose after the culture's obtained. Okay, good. So you most commonly hear patients getting pneumonia in the ICU with the mechanical ventilation, so the ventilator-associated pneumonia, like you said. And usually, if a patient's on the ventilator for 48 hours or more, they're at more risk to develop VAP. So the lung infection inflames the alveoli. It's very common, more than 3 million cases per year. It's life-threatening in what type of population? I heard geriatric?
Yes.
And, okay, good. Infants and children, right? And then if they're over 65. So some forms of pneumonia can be prevented with vaccine, not all of them. How does it spread? So airborne, good, yes. Coughing, sneezing, and it does resolve. It's short term, within days or weeks. Okay. The list of risk factors. We mentioned the older than 65. Malnourished, immunocompromised, someone mentioned earlier. And recent respiratory infection. Okay, so research, okay? So there's an article that I ran into. It's called Risk Factors for Hospital-Acquired Pneumonia Outside the Intensive Care Unit. I thought it was very interesting because I know you're a group of IMU nurses, okay? You'll probably receive patients coming from the ICU, and you need to keep in mind what type of risk factors would lead them to develop pneumonia, and just be aware, okay? So this article by Subpoena et al. And Krupp found that this type of population would develop hospital-acquired pneumonia on the regular unit, okay? So anybody with malnutrition, the chronic renal failure, anemia, and the multiple comorbidities. The majority of our patient population will have more than 3 comorbidities. So just keep that in mind and be active in trying to prevent for them not to develop the pneumonia. Okay? Any questions about pneumonia? Pulmonary embolism, common condition, more than 200,000 cases per year. Okay, and this occurs whenever one or more arteries in the lungs is blocked by a blood clot. So where does the blood clot come from? Usually?
The DTs.
Yes, very good. Do you need a... Yeah, no, go ahead. Yes, so the majority of the time it would be from a DVT. It is preventable and treatable. This one, PE is also short-term. It resolves within days and weeks. However, it is critical, so you must provide emergent care. Who's at risk for developing PE?
Patients that have been like lying down for a while with decreased mobility.
Yes.
Fractures.
Okay.
Hip
Surgery.
right, bones.
Good. Obesity, I heard that. Yes, that's one of them too. The hip fractures, very good. So you have the list there on the PowerPoint. Age older than 60. Smoker, notice for both pneumonia and PE, a smoker is at risk for developing the condition. Okay, anybody with pre-existing blood clotting conditions? You mentioned immobility. Okay. What about women who are on birth control? Right? Okay, very common. Okay, the research that I ran into for PE, Pneumonia et al. Basically just implementing anticoagulation therapy to prevent the incidence of DVTs to prevent PE. We know that pneumonia and PE, according to the research, right, the incidence of mortality is very high. And hospital costs are also very high. So we want to prevent the development of PE. Okay. Any questions? Okay. We're going to move on to signs and symptoms. Okay. I don't have administrative power, so I wasn't able to download the app for Pull Everywhere. So I'm going to open it up on, I think it's downloading. I don't know. It's installing something, but you go to the internet. So all y'all have smartphones, right? Pretty sure. So if y'all can, log on to the pullev.com /Ada Amaya 200, right? And it's actually a competition, so I do have prizes.
Y'all might not want me to play. I'm just kidding.
It's a good prize, too.
I know, right? That's why I want to play too.
Let me know when y'all are ready.
No, y'all can't get the prizes.
Why not? Oh,
I'm learning too.
I'm
learning.
ready? Yeah, you can do it on phone or computer. Donika's on the computer.
Y'all got it?
Polev.com.
Oh, Pole EV.
Yes.
No, Pole everywhere. Oh, PoleEV.com.
Right,
Pole
right. And hit accept, agree to the cookie. And then you're gonna put Ada, you see have a,
Oh.
He said the picture title which is in here.
Polev.com/Ada Amaya.
Yes.
Here you can use my phone.
Y'all use Kahoot.
Yeah.
Yeah.
It was kind of nerve-wracking. It's like, you
See,
see
I
everyone
really-
else, you can't think.
Go ahead and start.
Yes.
Okay, so this is the first sign, and you have to decide what clinical problem will present fever, pneumonia, PE, or both. Response is not assessed. Oh, because the poll's locked, right? Okay. Pneumonia. Very good. Yes. Okay. PE does, I don't want to confuse y'all, but it could be an atypical sign for PE, fever camp. Okay. All right. Next, sign or symptom. Oh.
What? I'm in
Oh,
number 8.
Hypoxemia. I have to click, huh? Okay, yeah. So, 20 seconds too much. All right. Both. Very good. That is correct. Boss chick moved up. Absent breath sounds. PE. Very good.
Oh.
Oh, smiley face moved up. Shortness of breath. Both. Correct. We got a 9% on pneumonia. Oh, Corey's moving up, y'all. Decrease level of consciousness or alter mental status. What patient would present? Someone with pneumonia or PE or both? Someone keeps changing their mind.
I don't want to watch a video on SSRX. I should answer questions like that. Can we just have a Kahoot?
You want the music? It should have some background music. Okay, sorry.
Ooh.
PE.
Because
Do
of
we know?
the saturation, right? Like they're not getting any, they could be a complete blockage. Is that why with the PE?
So think about your cardiac output.
Mhm.
When PE happens, you have what type of heart rhythm?
I'm guessing tachycardia.
Uh-huh, tachycardia, so-
We're trying to make up for it.
Right, trying to compensate,
So,
correct.
Can pneumonia not be one? Because if you're older, you would get a decrease because of an infection, right?
But it's gonna not happen to the same extent though.
But I would think like anybody that's confused, they could have pneumonia. No, but it's a good discussion. But I'm just thinking like an infection. That's where I was getting it. Like anybody that's like 65 or not, like just elderly
Could have
population
the
that had pneumonia, they're gonna be confused just because it's an infection. But I see it. It's not a typical sign. If someone that was like in their 20s that got pneumonia. Okay, I got it.
She answered her own question. But yeah, good thinking. Yes. Just for the sake of y'all not getting confused, okay?
Look, I was number 3 and I'm 6 now.
Chest pain? All right. Both, very good. What? Both of them have chest pain, but what could be a difference in the chest pain between your patient with PE and
Isn't like
pneumonia?
PE like a crushing type?
They have like that feeling of impending
Yeah.
doom with
Okay, very good. And it happens suddenly. Yes, very good.
And
it's
like
like
something
there's
slacking up a lot.
Good.
Your body's like overexerting itself.
Yes, yes, very good. Okay, so sudden chest pain with the PE, very abrupt. All of yes, very good. Leader, no one moved.
I didn't get my point.
Hypotension. Got 8 people on the board. Is everybody playing?
Yes, fun. I just
Okay.
Okay.
PE. Going back to the same.
Pathophysiology, right?
Yes. Yes. Okay. Very good.
Alright.
Nia moved up. Hemoptysis. Right. So what's hemoptysis?
Then when you're having a run of blood, right?
Okay, blood in the sputum. So, but this is a good discussion because what's the difference in them? They both have blood in the sputum, but with pneumonia, what do we call it? How is it? Yes, thank you. Blood tinge. And with PE? Say it louder. Bright red blood. Yes, so they both have blood in the sputum, but blood tinge for pneumonia. Okay, and the bright, yes, very good. Next, fatigue malaise. We're studying. Y'all hadn't studied for your SSRX. Hopefully, let's see. All right, both. So going back to the typical signs and symptoms, right, of your clinical problem, fatigue is seen more in pneumonia. Diva moved up. Impending doom. Someone said this earlier. What happened?
I said I get extra points for answering that fast.
still got pneumonia in both answers. Someone said impending doom, PE. It's sudden. The person feels like.
It's like an elephant on their chest, right?
That's more. I think you're thinking MI. Nia's still up there. Shaking, chills. Oh yeah, I answered that one quick. Total results 11. Okay. Very good. We got 100%. Cough.
I need this class too.
Both. So both cough. We had 64 for pneumonia. Yeah, remember we talked about hemoptysis? So they're both cough. All right. Diaphoresis. Sweating me.
I can be both, or neither one of them. I can argue every one of them.
Both.
Okay.
Crackles. Okay, majority picked correctly. Yes, crackles. We talked about with PE, absent breath sounds to the area where the. Okay, unilateral leg and edema pain. What patient would you see this on? Pneumonia or PE or both? Oh. Very good. 91% got it. What's the sign and symptom? I mean, what's happening? Yes. Very good. Who's breathing fast? Patient with pneumonia, PE, or both? Very good. That one was easy, huh? Tachycardia.
Oh my goodness.
Both. Absent lower extremity pulses. Very good. Okay. Put a lot on there. Sorry. Go for it.
Maybe that's why.
What do you mean by like muscle pain? Do you mean like I cough so much and I got muscle pain, or just muscle pain in general? Okay.
Oh, really?
Going back to like the fatigue, the fever, the chills, shaking chills, muscle pain with pneumonia. Syncope.
We can't answer.
Oh.
Yes, what I changed.
So why syncope for PE?
Because it has to do with circulation, right?
Yeah.
But I thought with pneumonia, you would also feel like lightheaded. You're not breathing well, right? You're not well ventilated, right? So there's not that good exchange happening. So why wouldn't that also cause syncope?
So kind of going back to what we talked about, the tachycardia is for both of them, okay? But your cardiac output with the PE is so low that the person can pass out. It's just so sudden.
Okay. Okay, so you might feel weak, but it wouldn't actually pass that threshold of I might actually pass out.
Right.
Okay.
Headache. I have a lot on me. I want to see who wins ours.
We can't answer.
Sorry, these are getting done. That was me too.
She said that too.
Mine, I like missed three.
Pneumonia.
Oh my god, I missed four because it was talking about.
Tactile vocal fermentus. Very good. How do you assess tactile vocal fermentus?
From the back.
On their back?
Demonstrate. What do you do?
1 minute. Okay, I'm gonna ask her to talk.
Okay.
To say 99?
Very good.
Good job. And what are you feeling for?
The vibrations.
Vibration.
Very
Exactly.
good.
Exactly. Good job. I remember that.
Yeah.
That's from head. What is class? Health assessment.
Self-assessment.
Arrhythmia.
So huge.
Very good. PE. All right. Who's AM?
Oh, good job.
Yolanda. Come on down. I got it right.
I'm a little disappointed in myself.
Yeah.
Who's Nia? Nia and Hart. Nia.
See you.
And Hart.
Good job. All my people. All my people. All my people.
There you go. Look, clinical able to recognize your signs and symptoms for PE and pneumonia? Okay. Assess RX and on the unit. Oh, very good. Okay. So, moving on. We're going to do case study. Okay, so partner up. Whoever's next to you, think maybe Ashley and Danica. Danica's behind you. Maybe. Would that work better? Or across each other? No, I don't know. Whatever works.
We're good. Yeah, we're good.
Yeah, okay. Because y'all two.
Oh yeah, okay, that works perfect.
Yep. Okay, few minutes, maybe 5 minutes to go over the case study. Some of y'all may have your notes, but you need to talk out what nursing interventions you would do for this patient. 66-year-old male, admitted with the cough and fever, 4 days. Had the shaking, chills, malaise, poor appetite. Sputum was thick and yellow with streaks of blood. A history of 50 years, 2 packs a day. Smoker, alcoholic, coronary artery disease, and diabetes. He's a ground student. So 2:30.
According to what
So I mean, yeah, but like, how will we know more about it? I'm asking because I don't know. I'm not asking for this. Yeah, that's what I'm saying.
No, it's
just to
okay.
make it clear. I'm not asking because I'm teaching. I'm asking because I'm asking.
I know, but that's okay.
I'm like, how do I know that it's working, right? Of course, they expect.
One more minute. All right, ladies. So, y'all ready? So, you can list, the priority interventions for our patient. We're just going to go down each group, maybe one, y'all can list. We'll do for this case study, one person can answer, and then the next case study, the other person can answer, okay? So you ready up here in the front, Corey, or? Okay.
Just down. I put head of the bed, oxygen. Oh, head of the bed.
Head of the bed up. Very good. And why do we raise the head of the bed up?
For circulation and breathing.
I heard lung expansion. Okay. Next group.
Incentive spirometer.
Incentive spirometer.
Yeah.
Okay.
So they can be able to ventilation.
Okay.
Instrument of the ear sacs.
Okay. Very good. Next group.
We put X-ray, but I'm also gonna put continuous pulse. Just make sure that their oxygen doesn't go down low.
Okay, to monitor their oxygen level and the chest X-ray. What are you looking for in a chest X-ray?
Low fluid. But is it light or?
The infiltration.
I don't know if you're looking at you if it's light. Okay, I'm sorry.
So the consolidate the patches, right? Very good. Okay. Next group. Sputum. Very good. What type of? So that's the
We
order.
need to know what kind of infection they have.
Okay.
Antibiotics to give.
Very good. And our group over here on this side.
What else we have? We have encourage fluids to thin that sputum, right? That's a really easy way to provide effective care. Also, we want an RT consult.
And then
Okay.
Right.
You'll expect an RT consult.
Education,
and coughing.
education, of course. We're gonna encourage smoking cessation.
Okay.
Let's see what else. Suction is required.
We have nutrition consult.
Yeah, nutrition consult. Encourage mobility.
Okay.
Right, just because he has pneumonia doesn't mean that he has to just lie down in the
Okay.
bed, right?
Okay. Very good.
And of course,
Um,
administer medications.
Then keeps monitoring the lungs.
So medications, labs. They gave us a whole. Good. Good. Very good.
You're the last one,
So
right?
you were. So you're covered. Yes.
No, what about chest physiotherapy? She says like they only do it on cystic fibrosis, but I was wondering if you have like something like in the lungs, whether or not that would be effective. This is nothing I learned. I'm just wondering. Have you ever heard anything like that?
Physiotherapy. Not that I'm aware of for pneumonia.
So no beating on patients.
It's for cystic
Please
fibrosis.
don't beat on your patient.
That's always a teaching moment, right? Let the patient know what you're doing. Okay, so to focus on the priority nursing interventions for your, for your assessment, okay? This is based off your, what they call your cluster list, okay? So you want to let the doctor know, right? We mentioned, y'all said vital signs? We
Yes.
got O2 over there.
Yes,
Good,
O2.
yes.
Raise the head of the bed.
Listen to the lungs. I think you guys said we got the raise of the head of the bed. Very good. Okay. Anticipate orders. I heard a chest X-ray. We got a sputum. Okay. We got the medications over here. Okay. Pain. That was not on your list, but someone with pneumonia, right? We talked about chest pain. You've got to think about pain relief. And y'all mentioned IV fluids over here. Good. And antibiotics. Okay. And everybody understands the rationales behind what we're giving, the orders you're going to anticipate receiving, right, from your doctor? From the doctor? Good. Okay. And you continue to monitor. What are you monitoring to prevent what? Hypoxia.
The vital sign to prevent, to make sure there's circulation, like effective circulation, and then like you want to monitor the labs to make sure that whatever treatment they're taking, they're on, is effective.
It's effective,
Yeah.
okay? And let's say it's not effective. It gets complicated. What's worst case scenario for someone with pneumonia?
Sepsis.
Ah, thank you. That's what I was looking for. Very good. All right. So next case study. Okay. Y'all can discuss it. Again, priority interventions. Thinking about your assessment. For our patient, 62-year-old female, admitted with bilateral lower extremity cellulitis, complicated by venous stasis. She was a smoker too, or she is a smoker, obese, anxiety disorder, COPD, hypertension, osteoarthritis. And all of a sudden, she starts complaining of feeling anxious, short of breath, and chest pain. You got to report that she's a retired administrative assistant. So how do you intervene?
I put it for diagnostics.
Structure of the lungs,
meeting was, because you get their negative.
It's just me, so.
Yes.
In the book, it says,
Yeah, but it's not for the
it's for,
Instagram is not
it's
for
for PE.
it's for the articles, right? To see what the thoughts are.
Oh, no, it's invited.
Right?
It's for the, to see where, to see, yeah, to see where the class.
Yeah.
I feel it's very important.
Yeah, you see what I'm saying? It could be an angiogram, it's a visualized arterial throughout the body, not the lung. It's anywhere.
Yeah, they all carry
That's what I'm saying.
carry blood to the lungs. Blood away, blood to the lungs.
It could be to the heart. That's what I'm saying. You say angio, it's not for the lung. You're saying the angiogram.
This is it. Yeah, this is it. It depends. I don't know how it is. I'm putting this just the article, so I'm here with you.
That's what I'm saying. It's a good thing. But I'm just saying it's not one of those lungs. It's for the lung. That's what angio.
There's this one that thing that shows you, that shows the
We didn't even put it.
This one that has to do, it helps with how the blood flow to the, how the blood flow in the blood vessel. Because I just started working on my
Oh, okay. And you're just doing, oh, okay, okay. I thought you meant like that's one of the.
No.
Yeah,
Oh, yeah.
It's just for the, no, because I have to put in the outback. And it shows that, and it shows that it has a blood, it needs blood flow to the lungs. Yeah, it kind of shows how the blood flows throughout the blood vessels.
One more minute.
It's just an extra.
Why we're treating this thing in a prison is okay. That's what I think. So you're saying because we're treating them, so we're trying to get them out of it and then not to happen again. Oh, okay.
Okay, we'll start with Nia and her buddy. And Halima, thank you. Okay, couple interventions, priority interventions for your patient who suddenly complained of chest pain.
I think so.
We're gonna start by.
What did you call that? Anticipatory order?
Yeah, anticipate orders for.
Anticipate orders for 12 lead for the patient. Then the order for the meds for anticoagulants and
So why would you do it?
orders
Why would you do an EKG?
to check for to monitor the heart the heart functions.
Okay.
You got the chest pain.
Chest
Yeah, because
pain,
you got the
and
chest
that
pain.
would rule out
MI.
Very good.
Yeah.
Okay. Yes.
So
You had
then for
another
the-
intervention, you said?
Yeah, administering the the order we anticipated from the physicians, like the anticoagulants and the
So what do you have to do to get those orders?
put in
There,
orders.
there you go.
Oh.
So you're gonna call them. You're gonna call them now, or you're gonna call them stat.
Stat.
That's a stat call. Okay.
Stat.
How would we know? Because I put on here consider rapid response, right? How would we know when the rapid response is appropriate? So is it, oh, I have the chest pain, or is it the combination of the chest pain and the shortness of breath with the sudden onset? Or would y'all call a rapid response in this situation?
Passing out.
Okay. So what interventions do you perform before calling a rapid response? Y'all said call the doctor.
The vitals, of course.
There you go. Vital signs.
Sit them up.
Anybody
O2
else?
sats.
Okay.
Yeah.
What else?
Assess like the lungs.
Okay.
Heart.
Okay.
Then
So depending on that, right?
then the CT scan, do you do them stat or
So that would be a stat for
PE?
yes,
Suspected PE?
correct. And then, so what other orders would you anticipate from your doctor? We'll start from
Yes.
the group in the back. Or,
D-dimer, VT scan.
very good. So your D-dimer, if the patient experiencing the PE, what do you expect it to be? Positive, yes. Positive, high. Okay, good. What other labs? Very good. Yes. ABGs. Your ABGs, what result do you expect from the ABG?
Metabolic?
So it's respiratory.
Respiratory.
It'll be alkalosis. It'll be alkalosis. Yes. And that's because, there you go. Okay, very good. What about kind of correlating with the EKG ruling out MI? What other lab work can you do?
BNP?
It relates to MI.
Oh, troponin.
There you go. Troponin. That's what I was looking for. Very good. Y'all mentioned CT? Okay, good. CTA. So if that D-dimer is positive, high, then we move on to the CT. Okay. Yes. Which is the gold standard to diagnose PE. Okay. So what are we worried about with the PE? When we continue to monitor,
O2 sats.
what's the worst that could happen? Say it, Danica. Yes. Okay. Yes. So we're good. And then I think I heard when I was walking around, education. So what would you teach a patient? Let's say they've got the treatment. What type of treatment? We didn't talk about this. Heparin.
Yeah, we said,
Okay, you did
I
say
said
it.
anticoagulant and thrombolytic.
Okay. What's the difference between the anticoagulant and the
If
thrombolytic?
it's
The
thrombolytic,
other
because
one-
we have an embolism, right?
The
So
other
we
one
need to
we
break it
have,
up.
the other will help.
break down,
We
yes.
got preventative, right?
No, the anticoagulant will help the blood not to clot,
Prevent
and then
clotting.
the thrombolytic will help whatever clot you have to dissolve.
Very good, very good. Okay. So the patient that suffered the PE, let's say they got their heparin, they got their treatment. What do they usually go home with? Okay, good. Yeah, warfarin, Xarelto. And so what teaching would you provide?
Vitamin
Oh,
K.
like don't like the razor.
Yeah,
Okay.
shaving with electric razor.
Very
Vitamin
good.
K, not to change your green leafy intake.
Very good. Okay.
Yeah.
Very good.
Is it okay to ask them to wear what is this bucket's name? The
It
yeah,
is.
compressions,
Right.
the stuff is
And
at
that-
home.
It is. They can, and that's one of the interventions for here, right? In the hospital, TEDS, and your sequential SEDs. Yes, very good. Okay. Any questions? No? All right. We did that. We notified the doctor. We reviewed the medications, labs. BQ scan. We didn't mention that. You did say. Okay, good. Thank you. Okay. Summary. So, basically, with your nurse-patient relationship, okay, we demonstrate humanistic, okay, nursing. It represents a dynamic process, and you want to care for your patient in a holistic manner. We talked about pneumonia and PE, they're respiratory problems that require immediate attention. You need to recognize the signs and symptoms to be able to differentiate on what action you're going to take. Okay. You do have a test, ladies. It's a quiz. It's a quiz. I shouldn't have said
She
that.
has to see if we learned it. That's for your school, right?
Okay, good.
If our teaching was effective.
That's for me.
Well, you were a good educator, so I'm sure we'll do good.
And you made it fun. Okay, thank you. Thank you.
Good job, David.
Good job. says 12 a.m.
So this is the full time. Yeah, it's over there. It's in the November 11th, 18th, that way. And so when you do your schedule, access to
I was like, no, I'm not doing this no more.
So you do that one.
I can do, I can take care of
Does it fit? I like when the
You ready? We can go over the answers and I'll go. Oh, Taylor, yeah. Yes. She's already here.
Yeah.
Okay. All right. Thank y'all. All right. So we're gonna let me get over here. So. Okay. Question 1. A client has been diagnosed with right lower lobe pneumonia. Upon auscultation of this lung field, the RN would expect to hear which breath sound? Very good. Which lab value alteration is likely a result of client experiencing a PE? Very good. RN understands that which of the following clients is most at risk for developing hospital-acquired pneumonia?
ventilation. The one on ventilation?
Yes, yes. Intubated, yes, good. In order to prevent PE in a bedridden client, the RN should do all of the following except
Antibiotics?
good. And the 32-year-old admitted to the IMU complaining of chest pain, shortness of breath, fever for the last 3 days. Upon assessment, you note the blood tinge cough. What's your most appropriate conclusion?
Pneumonia?
Impaired gas exchange related to pneumonia. Very good. The day shift RN is receiving a report on her client assignments for the day. It would be most important for the RN to see which client first. Very good. 45-year-old female client recently been diagnosed with pneumonia. She asked if she can still smoke cigarettes after her treatment is complete. What's the RN's best response?
Number C, right? The letter C.
Yes, smoking is highly discouraged after suffering pneumonia. So can I help you seek out resources? Very good.
Actually, the second one also is good, but it kind of sounds harsh. Like you're passing the information, but in the wrong way.
Yes, yes. So you want to, I know she mentioned the language of caring, right? Good. A client diagnosed with pulmonary embolism will likely have all the following symptoms. Select all that apply.
There was like shortness of breath. There was like blood
Yes.
Yeah.
Yes. Sorry, shortness of breath, chest pain, fever, bloody sputum, technique.
It was all
Everything except one.
Good. All of them except fever. Very good. And then the bonus one, the 51-year-old client has been diagnosed with pneumonia. Okay, you had to put your interventions in order, right?
Yes.
Because you know that he's breathing rapid and shallow. So very good.
Listen to the lung sound.
I'm kind of confused and listen to the lung sound and the O2 sound of POTOS. Which one comes first?
Okay, so yeah, I knew that one would be a little confusing.
Yes.
So, number 2, place the pulse ox on the client.
That should be the tool. Not listening to the non-sound.
That makes sense, because you're getting instant feedback on that one, right? Whereas with the lung sounds, I can be looking at the other stats while I'm assessing.
Yeah.
So that makes sense. Okay.
So very good though. Y'all got the 1, 2, 3. 4. And the last one. It's not priority, right? Very good. All right. Thank y'all so much for your time. Thank you. My
Good job.